In 2010, the Robert Wood Johnson Foundation selected the University of Kentucky as the home of the new National Coordinating Center for Public Health Services and Systems Research. Just a few months later, the National Coordinating Center is already off and running, providing valuable resources and support to researchers, practitioners, and policymakers. To help build the infrastructure and further cement the field of PHSSR research, the Center has established 4 work groups under the National Advisory Committee. The Building the Evidence work group will focus on natural experiments and evaluative research. The second work group, Research Capacity, will address methodological support, TA, and training opportunities. The Practice Application and Translation Work Group will look at opportunities for practitioner training and means of translating promising findings. The fourth work group, Expanding Funding, will focus on ways to engage current and potential funders. The National Coordinating Center is supporting current research by harmonizing and integrating data and putting richer information, an integrated data set, and bibliographic resources at researchers' fingertips. Plans are in the works for harmonization of additional data. We have a unique opportunity to set the course for the future, and the National Coordinating Center has begun to chart that course. Working with the Centers for Disease Control and the Robert Wood Johnson Foundation, we are establishing the new PHSSR research agenda. As part of that process, we are coordinating with practice-based research networks to give the practice community a voice in research questions. You play a vital role as well by providing input over the last week by electronic survey, the results of which we'll discuss at our closing panel on Thursday. 29 junior faculty or doctoral dissertation candidates from across the nation have been awarded mini grants, and tonight we're announcing the launch of a new initiative that will use dissertation grants to draw new, young investigators to the field.
There is nothing better for a junior faculty than to have a home for their research. The National Coordinating Center for PHSSR has provided resources, support, and guidance for me over the last 4 years. This type of interaction has been important in so many ways, both in helping me grow as a PHSSR researcher and getting exposure to this growing community.
In collaboration with the Robert Wood Johnson Foundation, the National Coordinating Center is identifying potential partners from both government and private sectors. We also continue to work with and through the PBRN National Coordinating Center and the National Network for Public Health Institutes to help groups develop the capacity to approach and engage interested local foundations. One of the key roles of the National Coordinating Center is to do as the name says, coordinate. We're coordinating and uniting the activities of our partners, including Public Health Law Network, Public Health Law Research, Practice-Based Research Networks, Public Health Finance, Academy Health's PHSSR Interest Group, and the National Network of Public Health Institutes. One of the National Coordinating Center's most valuable roles is taking what we're learning and using it to mold policy. To that end, the Center is working with public health law research to make policy implications of findings more easily translatable. Once a year, the Center hosts the Keeneland Conference as an opportunity to network, share ideas, and showcase and share researchers' work. But building connections doesn't only happen once a year. Every day, we're connected through social media on Facebook, Twitter, YouTube, and LinkedIn. You can even click now on the QR code you'll find on the inside of your Keeneland Conference notepad to link directly to the Center's website.
The Keeneland Conference is the place that I look forward to participating in interdisciplinary discussions and receiving hands-on training to improve my knowledge and skills of public health services and systems research. The conference always serves as a reminder that I am not alone in studying organizational factors related to the public health system, as complex as it may be. It is also reassuring that the staff of the National Coordinating Center for Public Health Services and Systems Research makes a concerted effort to ensure that researchers and practitioners remain connected, as well as provide financial and technical support to new investigators.
You may notice a new look of the National Coordinating Center website, and more changes are coming soon. We're designing it to meet your needs, so be sure to complete a quick website survey while you're at the conference and let us know your thoughts about features that would be most useful to you. Our online community keeps growing. We now have more than 500 members who receive regular electronic updates via the Inside Track e-newsletter and alerts, and we share news about various PHSSR topics, funding opportunities, and events through the other organizations' newsletters. Healthcare reform has opened the door for potential federal funding to support PHSSR and presents opportunities for us to assist in assuring the infrastructure delivered is as effective and efficient as possible. In addition, the Center is approaching national foundations to determine if they have a shared interest in improving the public health system. We want to hear what you think about the future direction of PHSSR research. Share your thoughts at our Facebook page and add your voice to the discussion at our closing panel session. We've come a long way since a small, pioneering group of researchers saw the potential of the field of health sciences research to be applied to public health. We're proud of our growth since the 1990s in the field that has led us to this day, when we officially launched the National Coordinating Center for Public Health Services and Systems Research. It's been a long road, and the finish line isn't in sight, but we're proud of the race we're running together and excited about the future of PHSSR.